Hi, I'm Darren Calley, and I'm the core faculty member in the Doctorate of Physical Therapy program at Mayo Clinic, Rochester. I'm also the director of our Neurologic, Orthopedic, and Sports Physical Therapy residencies. On behalf of our research team and as lead author, I'd like to share highlights from our study, Comparison of Abdominal Aortic Palpation with Ultrasound Imaging Measurements in Healthy Individuals. We launched this project to investigate how accurate palpation really is when screening for abdominal aortic aneurysms. Physical therapists are trained to screen for non-musculoskeletal conditions. If a patient's history suggests possible abdominal aortic aneurysm, an abdominal exam, including observation, auscultation, and palpation, often is done, especially for unexplained back or abdominal pain. But despite its routine use, palpation accuracy for assessing aorta measurements has been questioned. Palpating the abdominal aorta is simple and requires only a tape measure, which has made it appealing in clinical practice. Indeed, palpating abdominal aorta width has been reported as a significant contributor in making referral for patients with suspected vascular-related low back pain, with up to 30% of asymptomatic abdominal aortic aneurysms identified during routine physical examinations. But concerns remain about how well it detects an enlarged aorta. Ultrasound imaging of the abdominal aorta is the standard of care for abdominal aortic aneurysm screening. Relatively little is known about novice examiners' use of point-of-care ultrasound, sometimes known as POCUS. Moreover, no one had specifically studied how novice physical therapist examiner or student aorta palpation examiners and POCUS measurements compare. Our publication adds new evidence to this conversation, and the findings are worth considering in how we approach screening. In our study, we enrolled 50 healthy adults. 2 novice physical therapy examiners, second-year physical therapy students, measured each participant's infrarenal abdominal aorta using 2 methods, a basic 2-finger palpation technique and using a Vscan handheld POCUS device. Visualization of these measurement techniques are found in Figures 1 and Figure 2. Measurement order was randomized and 25 subjects returned within a month for repeat measurements. The student examiners completed 5 hours of training on both techniques. So, what did we find? On average, POCUS measurements showed the transverse aorta width was 1.54 centimeters, whereas palpation width measured 2.51 centimeters, almost a full centimeter wider, and a 61% overestimation. Previous research found estimates closer to 14 to 20%. We did find a positive correlation between palpation and POCUS measurements, but as visually shown in the scatter plots of Figure 3, palpation accuracy dropped off as the aorta got larger when it matters most. Both methods showed moderate intrarater reliability with an ICC of 0.58 for POCUS and 0.59 for palpation. However, variability probably tells us the bigger story. Repeat POCUS measurements differed by only 0.16 centimeters on average, while palpation varied by 0.74 centimeters, nearly 5 times more. Also, 100% of POCUS repeated measures stayed within 4 millimeters, a common standard for good agreement. Yet for palpation, less than half, about 46% fell within that range. This suggests palpation is less precise and more variable. So what does this mean? Palpation alone probably shouldn't be relied on to measure aortic width. It tends to overestimate size and becomes less accurate with larger aortas. Our study was not without limitations. We used young, healthy individuals as subjects and novice examiners. We reported moderate intrarater reliability and didn't assess intrarater reliability. While 5 hours of training examiners received were felt to be sufficient, we believe additional POCUS training could further improve novice POCUS measurement accuracy. Nonetheless, with POCUS more accessible than ever, physical therapists increasingly have access to a better tool for abdominal aorta screening. Our study supports including basic ultrasound training in DPT programs and continued ultrasound education for clinicians to help make stronger abdominal aortic screening and referral decisions. In closing, Doctor of Physical Therapy providers are trained to perform a thorough review of systems and systems review, including recognizing signs of serious medical conditions. Adding point-of-care ultrasound for aorta screening can help us make better informed decisions. There's more to learn about the differences with aorta palpation and with ultrasound measurements, including repeating this research in patients with confirmed abdominal aortic aneurysms and using more seasoned clinicians. If you'd like to learn more, you can read our full article, Comparison of Abdominal Aorta Palpation with Ultrasound Imaging Measurements in Healthy Individuals, in the July 2025 issue of the Cardiopulmonary Physical Therapy Journal. Thanks for watching. Let's keep raising the standard of care in physical therapy.